Hi there, my name is Elaine. This upcoming flu season, pharmacies will be faced with an overwhelming upsurge in patients seeking the flu shot. 25% more Canadians intend on receiving a flu shot this year compared to last year because of COVID-19 concerns. Additionally, fewer vaccination sites will be available due to the closure of many clinics. We've also seen significant supply issues during Australia's flu season this June, resulting in rationing of doses among waitlists of hundreds at many clinics. We understand if there is hesitancy among some pharmacists about conducting flu shots this year, but this is also a fantastic opportunity for pharmacies to serve more patients and stand out within the community. Our goal for this three-part series is to equip you with not only the tools, but also the confidence to conduct flu shots safely during this pandemic. We will guide you on how to implement an appointment-based flu shot program that will enable you to manage all your existing patients and establish relationships with new patients and other healthcare providers. I'll also be highlighting the MedEssist vaccinations platform, which we've designed to make this entire process remarkably easy. However, we hope we've made this video series general enough to be helpful for any pharmacist conducting flu shots this year. In this video, we'll go over why an appointment-based flu shot program is recommended during this year's flu season and how you can leverage this model to proactively organize your flu season and grow your business. In the second part of the series, we'll discuss exactly how to implement an appointment-based flu shot model that gives you full control over your workload while maximizing the safety of your patients and staff. And in the final part of the series, we'll outline best practices and recommendations to safely administer flu shots during the COVID-19 pandemic. Our coverage will include a discussion on PPE and how to conduct both in-pharmacy and in-vehicle shots. This year, Health Canada recommends pharmacies take on an appointment-based approach to their flu shot services. Appointment-based flu shots enable your pharmacy to take control of your team's vaccination workload each day. This will allow you to moderate patient traffic, prevent crowding, and properly sanitize the space in preparation for each vaccination. Appointments will also enable all flu shot recipients to be screened for symptoms and potential exposure to COVID-19 before they arrive at the pharmacy. A true appointment-based model should replace almost all walk-ins and serve the majority of your patients. An appointment-based model is not just an e-booking form on your pharmacy website. It's a system that should work for your patients whether they have access to technology or not. The goal is to make your practice more efficient, reduce walk-ins, and prevent supply breakdowns, such as having a patient arrive at an appointment when there's no doses left. That's the system we've designed at MedEssist, so let's get started. First, let's talk about promotion and marketing. Our appointment-based model allows your pharmacy to have patients reserve their dose early, even before flu shots arrive. This means that you can start patient registration in September before others have started their flu promotions. Your pharmacy can accomplish this in a multitude of ways. This may include placing posters and signage throughout your pharmacy, having front store posters and banners which can be helpful in capturing foot traffic, informing your patients at pickup and drop-off early in September, collaborating with neighboring clinics, especially those that have gone virtual, to refer patients to your flu shot services, and posting on your pharmacy's website or social media platforms. With MedEssist vaccinations, we provide you with poster and handout designs to help with promotion. We also enable patients to register at your pharmacy by using our e-booking portal, bookmyshot.com. This way, you will not need to develop a pharmacy website, but still have a great user flow that leads patients back to your pharmacy. An appointment-based flu shot program also enables you to proactively ensure that all your patients are coming back to you in a safe and organized way this flu season. First, you'll want to compile a list of patients who had received a flu shot at your pharmacy last year. Then, your team can call these patients to schedule an appointment this upcoming season. For example, that phone call can go like this. This year, we're doing flu shots a little differently. In order to prioritize safety, flu shots will be done by appointment only. If you're interested in booking an appointment, we can reserve doses for you and your family right now. Secondly, you can reach out to nearby clinics that you normally work with to see if they'll be conducting flu shots this year. For clinics that aren't, you can print out a list of all your patients that go there and promote your flu shot campaign in this way. If your pharmacy serves a multilingual population, you can have staff that speak those languages make calls for those patients and assist them with the registration process. If you're using MedEssist vaccinations, you'll be able to quickly register patients in person if needed in just a few seconds. We've made the registration process extremely easy so patients can reserve doses for their entire family in less than a minute. From there, the system takes over. Patients are sent follow-up emails to do all their documentation and COVID-19 screening at the appropriate times. We'll talk more about documentation in the next video. If you have patients that do not have internet access, they can still register by talking to a pharmacy team member who can easily register that patient on their behalf. The pharmacy can register patients to only receive communications by phone if they do not have internet access. All in all, by planning for an appointment-based flu season early on, your pharmacy can truly make the most of a difficult situation and turn it into an opportunity to elevate and grow your practice within your community. Tune into our next video where we'll go over how to implement your appointment-based model, such as setting your schedule, documentation, and preparing patients for their appointment. Plus, we'll talk more about the MedEssist platform and how it can help you automate all those steps.